I'm Justin, and I'm going to start by responding to how the affirmative claims that they're going to solve this issue and why it will not work. So they claim that they're going to model the plan after Oregon's Death with Dignity Act, which they already explained the requirements. The patient has to be 18 years old, there's 6 months to live, and then a few tests are required. And I want to start by saying that they said that it has to be estimated by a physician that the patient only has to be 6 months to live or less. And that I wanted to respond to this by saying that physicians are often wrong when predicting how long a patient has to live. In a review of more than 4,600 medical notes where doctors predicted survival showed a wide variation in errors ranging from an underestimate of 86 days to an overestimate of 93 days. So that right there shows that doctors can be wrong, and in many cases, even if somebody only has 6 months to live, there have been many cases where they have been cured. So also too, they said that a patient has to be 18 years or older, but and my response is that 18-year-olds are not capable of making a decision of that magnitude because of the rational part of at the time a teenager's brain isn't fully developed yet until the age of 25. And so, in fact, recent research has found that adult and teen brains work differently. Adults think with the prefrontal cortex, the brain's rational part. This is the part of the brain that responds to situations with good judgment and awareness of long-term consequences. And teens process information with the amygdala, which is the emotional part. So if they're proposing to use the Oregon Death with Dignity Act, you might want to think about raising the age, if anything. And then also too, in their prescription requirements, they state that a psychological exam is required to determine that they are in a good mental state to make the decision and not depressed or there isn't some other mental health issue going on. And one psychological exam is not enough to determine if they have some sort of mental illness or they are depressed, or if they are making the decision purely because they have a terminal illness and they want to die. Only 6% of Oregon psychiatrists are confident they can diagnose depression after one visit, yet the Oregon and Washington state definitions of a psychiatric consultation permit one visit only. Psychiatric evaluation of individuals who die from assisted suicide dropped from 31% in 1998 to a mere 5% in 2003 and 2004. In the 2007 Oregon report, no Oregon patients underwent a psychiatric evaluation, and over the following 2 years in Oregon, less than 2% of patients committing assisted suicide were referred for a psychiatric evaluation. So a big part of their plan in order to make sure that patients are mentally stable is actually not even happening in Oregon. Also too, they say that it is a physician must inform the patient of other alternatives, and in most cases other alternatives are more beneficial because it can make a patient more comfortable and even allow them more time with their families, so that way they're not suffering as much. Palliative care specialist Dr. Man Mason says, one phrase that gets under my skin and breaks my heart is when somebody says, well, they told me there was nothing more they could do. There's always more we can do. Regarding Brittany Maynard, actually, we take care of folks like her all the time, and we're able to keep almost all of them very comfortable, he said. Brittany Maynard is somebody who was diagnosed with a terminal illness and had 6 months to live. And so, aside from the fact that other alternatives can be more beneficial, some physicians actually don't even let their patients know about the other options, so that would be a problem also. And then also too, they said that physicians are required by law to report all prescriptions, and that I'm going to respond to this by saying that it is impossible to regulate all physicians to make sure that they are complying with laws. In January of 1999, Barbara Hack of age 71 was diagnosed with amyotrophic lateral sclerosis, a progressive neurological disease. Almost immediately, she called Peter Rasmussen requesting a lethal prescription. He declined because he felt she had more than 6 months to live. She saw him again in March, and he wrote the prescription for her. He was present April 10th, the day she chose to die. He emptied 90 capsules into a bowl of chocolate pudding, and her 2 sons swooned it into her mouth. The doctor stayed for 2 hours and she died 12 hours after ingestion of a lethal drug. This does not follow the rules that they said of physician-assisted suicide, because the doctor was actually present there and helped administer the pills and helped her take them. He is only supposed to prescribe them and write her the prescription and maybe give them to her, but he cannot be present there when she's actually taking them. And the help of her sons is actually illegal also, because it has to be the patient themselves that is taking it, because it is their choice. So the physicians are not always held accountable, even though it is the law that they report all of their dealings. Now, a few disadvantages to the argument. I want to say that physician-assisted suicide or death puts certain lives above others. And social acceptance of physician-assisted suicide tells elderly, disabled, and dependent citizens that their lives are not valuable, and doctors who list death by assisted suicide among the medical options for a terminally ill or chronically ill patient communicate hopelessness, not compassion, and we shouldn't be putting any one person's life over somebody else's. And I also wanted to respond that they keep saying saying death with dignity, and I wanted to say that assisted suicide does not actually preserve a person's dignity. Human dignity ultimately rests on the value of a person, and the value of a person is infinite. Assisted suicide and euthanasia requires to accept that it is morally permissible to act with the specific intention and acting of making a somebody into a nobody or helping them kill themselves. And that one of my opponents said that doctors do not have to participate in physician-assisted suicide, but a lot of doctors are actually pressured into physician-assisted suicide, where there was one example where there was a woman, soon after the Oregon law of allowing a physician to write a lethal prescription for a patient went into effect, a patient named Helen asked her physician for one. She had a history of breast cancer and enrolled in hospice. She had been using a wheelchair for 2 weeks, and basically she went through 2 doctors that had denied her request until she got to a 3rd doctor. So even if doctors decline, patients will find one that will accept, and that doesn't really matter if doctors don't have to participate. Thank you.